If you suffer from knee arthritis, your doctor may have told you that you just need to lose weight. And while losing weight is often helpful for knee pain, being overweight is rarely the only cause. Furthermore, this advice can often feel frustrating or even dismissive, especially if your doctor doesn't offer any solutions as to how to actually lose weight. And even more so if the doctor happens to be carrying a few extra pounds himself. Additionally, if you went to your doctor for help, you were probably hoping for something more than lose 20 pounds and in 6 months you might feel better. In this video, I'll explain how to relieve pain faster, what to do to improve your cartilage health, and how to actually lose weight even if it hurts to exercise. Let's get started. Now, before we jump into how to relieve knee pain faster, it is worth noting that if you are carrying some extra weight, it is probably a good idea to lose it because it improves your heart health, decreases your risk for a number of chronic health conditions, and there is actually research showing that people with knee arthritis who lose weight do tend to experience less knee pain. But it does take time to lose weight, and you'd hate to get 6 months down the road and find out that the weight wasn't actually the problem causing your pain. So this first pain relief tip will help you decide if weight is actually the problem, plus it will relieve pain quickly. One easy way to tell if excessive pressure on your knee is the cause of your knee pain is to take pressure off of your knee. And an easy way to do that is using a cane or a wheeled walker. Now, when you use a cane for knee arthritis, you want to use the cane in the hand opposite of your painful side. That allows you to offload some weight onto the cane and take some pressure off of your knee joint. And if you find that it's more comfortable to walk with a cane or to walk with a wheeled walker, then you know that excessive pressure on your knee joint is part of the problem. So walking with a cane or a wheeled walker in the short term is an easy way to take pressure off of your knee. It also allows you to be more mobile and enjoy more of the things you might otherwise not do. Additionally, it allows you to get more exercise. And doing aerobic exercise where you're bearing weight through the joints is actually a good way to help improve your cartilage health and help decrease knee arthritis pain. So that's the first tip, using a cane or a wheeled walker. But what do you do if you don't want to rely on those over the long term? Well, another common problem people experience when walking with knee arthritis pain is improper walking mechanics. Often it's not so much the vertical compression that hurts when you have knee arthritis pain because your cartilage is generally well suited to withstanding that compression. And assuming that your cartilage isn't completely gone, you can usually walk if you have proper mechanics. Now, where people often suffer more pain is if they do too much twisting of their knee joint. That can happen as a result of mobility limitations in your ankle. If you don't have the mobility in your ankle to take a step like this, your body can get around that by pronating or flattening your foot. That in turn causes twisting at the knee joint, which it is not as well suited to withstand. Furthermore, if you have weakness in your hip, particularly your hip abductor muscles and your hip external rotator muscles, that can also contribute to the same movement problem, causing twisting between your thigh bone and your lower leg bone. So when you walk, you want to think about keeping your arch supported and not letting it flatten down like that. One easy way to do that is just thinking about gripping the ground slightly with your toes so it forms a little bit of an arch right there. Then as you take a step, you don't want to allow that arch to collapse down. Now that's partially a function of your foot muscles. It's also partially a function of your hip muscles. If you have weakness in the hip muscles, they can drive your knee inwards, which then affects the foot. So the cause could be at the foot, the cause could be at the hip, or it could be both of them. However, rarely is the cause actually the knee itself. It's just the thing in the middle getting beaten up. Now, furthermore, if you lack mobility in your ankle joint, that can also cause you to have to go around it and overpronate. So doing a calf stretch like this can also be helpful. You don't want to allow your foot to flatten out when stretching your calf. So you again want to think about doming the arch, making sure that stays elevated, and then just taking a small step like this to stretch your calf. Hold for 1 to 2 minutes, just feeling a gentle stretch. So those are some tips to help you improve your walking and decrease your knee arthritis pain. Now, like I said, aerobic exercise is incredibly helpful for cartilage health. But if you can't walk for long periods of time, even with a cane or a wheeled walker, there are some other ways to unload your joint to allow you to get blood flow and that compression and distraction and movement to help restore your cartilage health. For example, using a seated stepper, a recumbent bike, or a rowing machine are all great forms of aerobic exercise that are easy on your joints. Additionally, exercising in the water, and specifically warm water, is especially helpful for people with knee arthritis. But aerobic exercise alone isn't enough. You also need to get your muscles stronger so that they can hold the extra body weight while you're focusing on losing it. One great way to strengthen your legs is just doing a sit to stand. And when you do this, you want to think about keeping your hips, knees, and toes in alignment. So lean your trunk forwards, keep your knees driven out, drive your heels down through the floor, thinking about pressing the floor down, then slowly lower your bottom back down to the seat. And then repeat for as many repetitions as you can until your legs get tired. Now that's great for strengthening your quadriceps and glute muscles, but what about balancing on one leg when you're walking? Well, a great way to do that is just to practice balancing on one leg when standing. You can hold on to something for balance if you need, or leave a toe down. You want to think about keeping your belt line level with the floor and your hip, knee, and toe in alignment without letting too much wobble happen like that. So try to stay as stationary as you can and work up to holding for 10 seconds or longer. That will help you to be able to carry your body weight better. Now, how do you actually lose weight? Well, incorporating some of those aerobic exercises that I mentioned earlier will help you to burn more calories, but the bigger contributor is diet. In order to lose 1 pound of fat, you need to create a 3,500 calorie deficit. If you're going to lose 1 pound a week, that works out to about 500 calories less per day. If you're not sure how many calories you're eating right now, keep track of it for a week. You can either write things down and look up the calories manually, or many smartphones have built-in apps that will do this for you. Or another rule of thumb that you can use is taking your body weight and multiplying it by 10 to 12 calories per pound of body weight. So if you weighed 200 pounds, then eating 2,000 to 2,400 calories per day will probably get you in the right ballpark. Now, where do you reduce calories from? When you're losing weight, not all calories are created the same. When you're building muscle or building cartilage, the raw material that you use is protein. And so when you're cutting calories, you don't want to cut protein. Now, how much protein do you need to eat? Research shows that older adults should eat 1.2 to 2.0 grams of protein per kilogram of body weight. Or if you're in the US, that's 0.54 to 0.91 grams of protein per pound of body weight. Now, protein has 4 calories per gram. So for example, if you needed 100 grams of protein per day, that would be 400 calories from protein per day. Then you would back that 400 calories out of your total number of calories per day, and that would be how many remaining calories you have to eat from carbohydrates and fats. The easiest way to cut calories is just cutting out excessive calories that carry very little nutritional value. That would be high sugar foods like sodas, candy, cakes, things that add a lot of excessive calories, but they don't provide much vitamins, minerals, or protein. On the fats ends, fried foods like potato chips or fried meats like fried chicken also add a lot of fat and calories without contributing significantly to your nutritional value. Now, just by cutting out soda, alcohol, and fried foods, you can probably reduce 500 calories a day. However, if you don't eat a lot of sweets or fried foods, other things to cut out would be processed carbohydrates like white breads, or if you add butter to things, you can cut out some of the added fats. Now, by decreasing how many calories you eat and increasing how many calories you burn through some of the exercises that I mentioned earlier, you can safely expect to lose 1 to 2 pounds per week. But that still takes 10 to 20 weeks in order to lose 20 pounds. And if you have more than that to lose, it can take even longer. So it does take some long-term commitment and dedication. But if you experience pain relief by walking with a cane or a wheeled walker, it's probably worth it over the long term. Additionally, it does improve your heart health and decrease your risk for other chronic health conditions. Now, if you'd like more tips to relieve knee arthritis, check out this playlist over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to the channel so you get notified of my future tips. Thanks for watching, and I'll see you in the next one.